Good morning, good afternoon, and good evening. I'm Dr. Moon. I'm a Korean facial plastic surgeon. Today my topic is repositioning of superfacial facial fat with end-fixed threads for facial rejuvenation. It is my great happiness to introduce my new thread rejuvenation technique with end-fixed thread. I'm a facial plastic surgeon, and today my lectures are based on my recently published anatomy textbook and also published paper in the PRS Geo. Then, as you know that sagging face and wrinkles are major aging sign for human, then how to improve sagging face and wrinkles? Surgery is the treatment of choice. Then, for example, smart resection and the smart application and facial liposuction. But there are many limitations of surgery like morbidity and the scar and unfavorable result. So nowadays, a greater focus has been placed on developing less invasive method, so-called cog thread lifting. These are the basic elements to understand cog thread lifting: vector, anchoring, the insertion layer, and the entry point, targets. So I'm going to explain each element one by one. The first element is the vector. There are two major vectors, the lateral vector and vertical vector. The vector is the direction in which the face is lifted. There are vectors for facelift. They are lateral and vertical vector. Lateral vector is lifting to improve nasal fold and meridian line. The vertical vector lifting can improve sagging jowl. So please remember these two important vectors for facelift. Then we know that there are many layers on the face: skin, superficial fat, SMAS, deep fat, and deep facial pressure. Then where can we go with our threads to make a best result? Then let's move to anatomy. Then we should understand where facial vessels are. The blood vessels in the face are protected by the muscles, the facial expression muscles. However, in some area, especially gap between muscles, the blood vessels are not protected by the muscular structures, so it is exposed to the subcutaneous layer. So when the subcutaneous fat layer is opened, we can see the exposed vessels very easily. And this is subcutaneous layer. I open subcutaneous fat layer. Then these are the facial muscles. Then we can see the exposed, the facial vessels like a facial vein and artery to the subcutaneous layer. So it can be very dangerous when we put the thread deep underneath the skin. What about the infraorbital nerve and artery? When you open levator labii superioris muscle, you can see inferiorbital nerve and inferiorbital artery. Nerves and artery, they are deep underneath LRS, and it is protected by levator labii superioris muscles. What about facial nerve? These are branches of facial nerve which comes out from parotid gland. Then they run medially, then go up to innervate the facial expression muscles. As you see, the facial nerves are just underneath the SMAS layer. And also on our face, there are very important the visceral structures, parotid gland and parotid duct. So parotid duct is mostly two finger breadths from the zygomatic arch, and anterior to the tragus, there is a parotid gland. How deep they are? I open the SMAS layer, and deep to SMAS layer, we can see the parotid gland. This is parotid gland. Also anterior to parotid gland, there is a masseter muscle, the facial artery, the facial vein, and even facial nerves. And probably in this area, the two finger breadth from the zygomatic arch, there may be parotid duct. We can see that the parotid gland and parotid duct, also they are just underneath the semestrial layer. It's not that deep. So we recommend to put the thread into deep subcutaneous layer. The reason why? It is safe and easy. And we know that superficial fat compartment are our major target, as superficial fat is going down as we age it. And both SMAS and superficial fat are actually one body. So when we dissect cadaver or when we do surgery like a facelift, we can understand that SMAS and superficial fat are actually one body. So where can we go? Definitely go into deep subcutaneous layer. So we should have a good anatomical knowledge for the subcutaneous layer. There are several important fat groups on our face: the malar fat, jowl fat, and retinal fat. Among these, malar fat and jowl fat are most important fat group for facial rejuvenation. And these fat groups can be separated by some the artery and some fibrotic tissues and some muscles as compartment. So infraorbital fat, nasolabial fat, and medial cheek fat, these are belongs to malar fat. And jowl fat, there are three fat compartments: superior jowl fat compartment, inferior jowl fat compartment, and middle cheek fat compartment. So these are our target fat group and target fat compartment for facial rejuvenation. And I'm going to explain more in detail why it is so important for us. This is a very interesting histology study, microscopic histology study. So as you see in this histology slide, the infraorbital fat is fixed to the deeper structures with retaining ligament. So I called it the fixed fat compartment. So I called infraorbital fat as the fixed fat compartment. Compared to this infraorbital fat, other two fat compartments like nasolabial fat and medial cheek fat are loosely attached to the deeper structure. So I can call it as mobile fat compartment. So why it is so important? This figure is the cross-section of the midface. The displacement of a mobile fat compartment occurs as a result of weakening of supporting structures. So, mobile fat compartment is going down as aged. By the way, the fixed fat compartment are not changed in position, even though we age it. So, as we age it, as we're getting older, the diffraction between two compartments will be happen. So we can understand why nasojugal group and malar can be happen as we age it. When we age it, infraorbital fat is not moved down, but other fat compartment like nasolabial fat and medial cheek fat is going down. So there can be nasojugal group and malar. So these nasolabial fat compartment and jowl fat can be our target fat compartment for facial rejuvenation. So what I think is thread lifting is to reposition sagging target fat compartment to the stable structures. This is my major theme for facial rejuvenation with the thread. And anchoring is also very important. The thread inserted into the face must be fixed to maintain the effect. In the past, many doctors prefer hard anchoring, which means to fix the thread in the deep temporal fascia or periosteum. Then we know that it is very painful after procedures and uncomfortable, and the thread can be broken very easily. So nowadays many doctors move to soft anchoring techniques, which fix the thread in the retaining ligament or fibrotic subcutaneous tissue. It can provide less painful result and less inconvenient result, and thread also hard to break. So I prefer soft anchoring the techniques. Then my target structures for soft anchoring is mainly zygomatic ligament and platysma auricular fascia. This is zygomatic ligament. Is quite long and wide ligament on our midface and lateral face. This is very strong and very long and wide ligament. Where can we fix our thread for facial rejuvenation? And another one is platysma auricular fascia. These thick structures just underneath the skin can be a very good anatomical structures to fix our thread for facial rejuvenations. Then, when we fix the thread, as I told you, our target structure is zygomatic ligament. Then our thread should be located in temple area. The temple area, the anatomical structures are quite complicated. Let's see the video. Skin, I open the skin, you can see the subcutaneous fat and the fascial structures. This is superficial temporal fascia. Just on this fascia, you can see the vessels, superficial temporal artery, superficial temporal vein, and the facial nerve. What you can see, what you can understand is these important neurovascular structures are quite superficial. And when we do facelift with thread, we put the thread on this fascia in the subcutaneous layer. Then we can have many chances to hit these important neurovascular structures like superficial temporal artery, superficial temporal vein, and even the facial nerve. So we need to find some other way to prevent some complication, and I will introduce my tips and pearls to prevent neurovascular damages when we put the thread on the temple area. So this is coronal section, the illustration of temple area. So this is skin, and this yellow structure is subcutaneous fat, and this pinkish structure is superficial temporal fascia, and this red one is definitely superficial temporal artery. The blue one is superficial temporal vein. And what you can see, then these structures are just on the temporoparietal fascia, so-called superficial temporal fascia, and also the facial nerve in this temple area is quite superficial, just underneath temporoparietal fascia. Facial nerve always follow pituitary line from tragus to the eyebrow area, and it goes just above to zygomatic arch to go to temple area, and after then they go up to learn just underneath temporoparietal fascia. So what we can see is all important neurovascular structures in temple areas are quite superficial in location. So when you put the thread in this subcutaneous layer, you should be very careful to prevent the complications. So what is my tip and pearls? Hydrodissections. I inject lidocaine with epinephrine to prevent neurovascular damages on temple area. So I inject lidocaine with epinephrine to make some safe space between skin and the neurovascular structures, and this space can be safe, the space to put our thread and threads for facial rejuvenation. So always I do hydrodissection when I put the thread on the temple areas. So these are keys to explain the basic elements for the thread lifting. In order to avoid complication, it is mandatory to know the danger zone. And if you are not familiar with anatomy, it is safe to inject a thread, put the thread into a subcutaneous layer. And it is safe to do hydrodissection when you put the thread in temporal area. And pinching anatomy is very important. Reason why we don't have a device like ultrasonography when we do thread rejuvenations. Then how can we understand where our threads are? So I recommend the pinching anatomy. We know that on our face there are two structures, mobile layers and fixed layers. For example, skin, superficial fat, cells, and some muscles are mobile structures. So when you pinch up as much as possible, you can lift up skin, subcutaneous fat, cells, and some muscles. Compared to these structures, deep fascia, periosteum, and some deep muscles are fixed ones. So you cannot lift, I cannot lift these anatomical structures with our fingers. So if you lift up the facial structures as much as possible, we can lift the skin, superficial fat, and cells and muscles. So lift the facial structures as much as possible you can with your fingers and place the cannula into the space between your fingers. In the case, your cannula can be safely located at the deep subcutaneous layer. So this is my another tips to make a best result and to prevent some complication. Pinching facial structures as much as possible and put the cannula between your fingers. In the case, the cannula can be located very safely in the deep subcutaneous layer. And also, if you have ultrasonography, you can apply ultrasonography to identify some vascular structures, and even you can see your cannulas with ultrasonography. So nowadays, many doctors are applying ultrasonography for the thread lifting. So I think that in the future, ultrasonography can be the tools to make a best result with the threads. And today I'm going to use the N-fixed thread for facial rejuvenation. And these threads look like this. We make this triangular shape space with some punching procedures. So we called it punching cog. Then you should understand history of a cog thread. Very early time, long time ago, we cut the thread to develop the cogs. So we call the cutting cog. After then, molding cog had been developed for the facial rejuvenation. So molding cog is very simple. To put the thread into the mold to make some cog. So I called it the second generation cog. Then finally, N-finders, they developed the punching cog. This is third generation the cog thread. Definitely more powerful in tensile strength compared to molding cog and cutting cog. So longer duration effect. They can provide longer duration effect. And also they have very strong tissue holding effect. So I prefer to use the punching cog type thread for my repositioning superficial facial fat compartment technique. So this is multiple dual cog barb thread, very strong in fixation. So more neocollagenesis, the region-wise more contact surfaces. So more multiple the growth factor and best for rejuvenation. So for my technique, superficial facial fat repositioning technique, definitely I recommend to use the punching type thread, the N-fixed thread. So from now on, I'm going to introduce the techniques. So entry point is always very important. Region-wise, we should put the thread from this entry point. And entry point, when you decide the entry point, you should think about the vector, the facial vectors. I prefer the 4 entry points on our face. The first one is the A zone, I call the temple triangle. This is fetangular line, and this one is zygomatic arch, and this line is vertical line from the temporal process notch. So this triangle is quite safe Reason why important neurovascular structures are out of this triangle. So facial nerve, superficial temporal artery, superficial temporal vein, and middle temporal vein, all important neurovascular structures are out of this triangle. So I like this A zone as an entry point. And another one is B point. B point is very useful when I try to improve meridian line. The reason why is I can apply lateral vector from this B point, and also, as I mentioned to you, in this B area, there is very tight structures, the platys molecular fascia. So it is just one finger breadth lateral to the tragus. So I like this point to apply a lateral vector. And also, if my target is turkey neck deformity or double chin, I like this C and D point for neck rejuvenations. So mostly I use these four entry points for facial rejuvenation. Then definitely the target fat compartment for mid face and low face are nasolabial fat compartment and jowl fat group. The reason why other fat compartment, for example, infraorbital fat compartment and lateral fat group, they do not change in position as we age. So this lateral fat and infraorbital fat are not our target fat compartment and not our target fat group. Our target fat compartment and fat group is only the mobile fat compartment and mobile fat group. So nasolabial fat compartment and jowl fat group are my major targets. So your end of the cannula should be located in center of inferior half of this fat here to make the best result. Then how can we do? First, to improve nasojugal group and to improve nasovalve fold, I put the thread from the A point, and also I can put the thread from A point to improve jowl. So these two thread is going down from entry point A to the jowl fat. So definitely this thread can improve the jowl formation. I can put 3 to 4 threads for jowl fat lifting, and also from A point I can put another thread to improve nasolabial fat. Sometimes I can put one thread, but if they have a very big and very sagging nasolabial fat compartment, I put 2 threads. And to improve nasolabial and the meridian line, this line, so I put the thread from the B point, upper PAF, just one finger breadth from the tragus. Mostly I put 2 threads to improve the meridian line. Totally I put 6 to 8 threads for one side to rejuvenate our face. And how to fix your thread with your cannula type thread? As you know, this end-fixed type of thread, very easy to fix. Just put the thread, then automatically they will be fixed. And another one is to put several threads into one entry point, and you can put more than 2 threads, and they fall in love with each other, and they hug each other, and the more strong anchoring. So I called it hugging anchoring. This end-fixed type of thread, no need to tie. So just we can apply the self-anchoring technique or hugging anchoring techniques. So what is the first of care? Very simple, ice pack. Ice pack to prevent swelling and bruise just for one day. And we recommend to wear the facial garment for lifting, and antibiotics mostly for 3 days. Then touch-up is very mandatory for thread lifting. We recommend to touch up every 6 months. But for the touch-up procedures, we put half number of thread compared to the first treatment. Then we can guarantee 2 years result. Same as filler injection and same as energy-based device treatment, same as botulinum toxins. Thread also we should do touch-up procedures every 6 months. Then we can guarantee 2 years result. Then I'm going to show the how can we do with M-fix. So, sorry. This lady, the major concern is nasolabial fold and jowl. So my target is nasolabial fat compartment and jowl fat group. Superior jowl fat and inferior jowl fat and medial cheek fat, these belongs to jowl fat group, and nasolabial fat compartment belongs to malar fat group. Then this area we can see some fat compartment. This is infraorbital fat compartment, and all the way this lateral area, the fat compartment, we called it lateral fat. Lateral fat is a fixed fat compartment, and infraorbital fat also fixed fat compartment. But nasolabial fat and jowl fat group, these belongs to mobile fat compartment. So as we age it, these superficial fats are going down. Instead, they compared to this fat, infraorbital fat and lateral fat, no changes in position. So even though we age it, these fats are still there, no changes in position. But nasolabial fat going down, jowl fat going down. So you can see the nasolabial fat, nasolabial fold, and nasojugal group, and also some depression in here, lateral cheek depressions. So to improve lateral cheek depression and the nasojugal group and the nasolabial fold, we should lift and reposition this nasolabial fat and the jowl fat. So this is my entry point to lift nasolabial fat and jowl fat. So this is a temple triangle. So phalangeal line and zygomatic arch and vertical line from the temporal process. So here, this area is very safe. So I inject lidocaine for hydrodissection. So even though this triangle is quite safe area, we know that there are many variations in anatomy. So we put lidocaine with epinephrine. Mostly I inject 1 cc. So to make a safe space to put our thread. So if you want to improve the meridian line, probably I make other hole entry point just 1 finger breadth from the tragus to fix the thread into the platys molecular fascia to apply lateral vector. But this lady, the meridian line is not that severe and not her major concern. So I just target nasolabial fat and the jowl fat. So I injected lidocaine for each side with lidocaine with epinephrine. So I recommend lidocaine with epinephrine region-wide. The vasoconstriction can also make vessel diameter smaller, so more safer. So I recommend to inject lidocaine with epinephrine. So I make a hole with 18 gauge needle. So always I apply these tap-tap procedures, as you see. So region-wise, I'm a beginner, so I cannot control the needle very well. So I just put the needle on the skin and I use opposite hand and apply tap-tap procedures to make a hole. Then you can control your strength to put the needle through the skin. Then you can prevent vascular damages and you can control the power very easily. So I like these tap-tap procedures. Then after that, we put the cannula. The M-fix thread is in this cannula. So cannula is going through the subcutaneous layer. So as I told you, these non-dominant fingers, we always important to identify the layers. And as you see, this is very important. Our target is this just jowl fat. So you should see my thumb. My thumb is fixed. I use this second and third fingers to lift jowl fat only. right? So other fat compartment, especially lateral fat, I fix the position with my thumb fingers, and I lift just only my target fat compartment, the jowl fat compartment. So I like hugging method. So I put many threads from one entry point, going to the jowl, same, and see my opposite hand fingers for pinching and to identify the layers, so-called pinching anatomy I applied. Same, fix, lift. Fix the stable structures, I lift, and reposition the target structures. From one hole, mostly I can put the 4 threads, 4 and fixed threads. These threads have a very huge contact surface, and very strong in tensile strength, so very ideal for this repositioning technique. So I put 4 threads to reposition jowl fat. After then, I cut the threads one by one. And please focus on the hands, the minors, the beautiful hands. And why she lift up mid face? To prevent some complications. One of the common complications after thread lifting is thread extrusion from the entry point, especially when they smile. Okay? So the first step, you can ask your patient to smile with the maximum effort when you cut the threads, or you can ask the assistant to push up mid-face as much as possible. After that, you can cut the thread. In that case, you can prevent the complication, the thread extrusion, when patient make expression. And let's move to the nasal fat lifting. Make a hole in this triangle and put the thread to our target fat compartment. So this is the technique for the Asians. The Asian, we do not like high malabone. So as you see, my thumb is exactly located on the infraorbital fat area, the mala area. The reason why I do not want to lift up this area. Reason why if I lift this area, probably my patient will kill me. Reason why this is not good in face leading in Asia area. So I do not want to make some volumes on the mala area. So I fix this area with my thumb and I just lift this nasal fat compartment. But if she is Caucasian, my thumb finger will be on temple area. Reason why I want to lift nasal fat and this infraorbital fat all the way. Reason why they like some high malabone, high lateral cheek, so-called hinder zone elevation. So for the Caucasian, my thumb finger will be located higher on temple area to give some volumes on this lateral cheek area. But for the Asian, they hate this high malabone. So my thumb finger is exactly located on the lateral mala, and I lift just the nasal fat compartment. And one more thing, though, you should know where our end of the cannula should locate, should positioned. Reason why end of the cannula does not mean end of the thread. Okay? It is about 4 millimeter longer than end of the thread. So what I suggest is our end of the cannula should be located center of inferior half to reposition our target fat compartment. So this is our target fat compartment. So our end of the cannula should be located below half center here. Otherwise, sometimes your cannula and thread is out of our target fat compartment. In that case, no result. A waste of money and waste of time. Other side, same. From the temple triangle, I put the thread to reposition the jowl fat, and also I'm going to put another thread to reposition nasal veil fat. Same. Infravitreal fat is not our target fat, and also retinal fat, no. Just try to lift and reposition jowl fat group and nasal veil fat compartment. So vector is always very important. A layer should be deep subcutaneous layer. To be safe and to be correct, you should use your opposite hand, the fingers, and all the way you can apply the pinching anatomy techniques. And you should check the location of end of the cannula. You should always think about vector and plane and plane and plane. And also the entry point and target fat. So very simple. If you know the target, if you know the vector, if you know the safe anatomical plane, everything's okay. So from another entry point, I'm going to the nasal veil fat compartment to improve nasal veil fat. In the past, I had been using the bidirectional, the molding cork thread, but nowadays I 100% change it to this end-fixed type thread. Reason why this is the best thread for my techniques. Okay, this is before and after. Okay. These are take-home message. Where can we go? The best plane is deep subcutaneous layer. And hydrodissection on temple area can provide safety when you put the thread in temple area. And we should understand that aging changes of each superficial fat compartment is different. Some fat fixed, some other fat mobile. So there are mobile fat and fixed fat. So we should know that which fats are mobile fat and which fats are the fixed fat compartment. And the thread lifting is actually not a true lift, but a repositioning of displaced superficial fat compartment. Thank you so much. So from now on, we are going to have a Q&A session. So if you have any questions, please write down in the chatting room. Oh, very good questions. So do you combine N-fix and HA fillers? I do not combine the N-fix and HA fillers. So in the same layers. So sometimes I combine the fillers with the thread together with, only when our target layers are different. For example, if I want to enhance deep fat compartment volume, definitely I put some fillers into the deep layers, but I do not inject fillers into subcutaneous layer when I put the thread into the subcutaneous layer. So when the target layers are different, target layer for fillers and target layer for thread are different, I can do together with. And always I do filler first. If I do both procedures in same session, same day, I put the fillers deep layers, like to improve soup volume, to enhance soup volume or to enhance deep medial volume. I inject fillers deep layers. After then, I put the thread into subcutaneous layer to reposition our superficial facial fat compartment. Very good question. Thank you so much. Okay, so for the face, I like two entry points. The first one is a temple triangle entry point. It's mainly to target the nasal fat and the jowl fat. And another one is the anterior upper pilates molecular fascia point, just one finger breadth from the tragus, just underneath zygomatic arch in here. So I mentioned it as a B point. This one is very important to apply retroviral vector to improve meridian line. But for the neck rejuvenations, I have two entry points. One is the mandibular angle, and another one is the center line of the neck area. So these 2 points is mainly for neck rejuvenation. But for the mid face and lower face, I like the temple triangle and upper pilates molecular fascia entry point. Thank you so much. For my demonstration, it's just local anesthesia. But if the patient are very sensitive for the pain and they are very nervous, in that case, I can apply IV sedation. But mostly about 80% my patient, they're okay for the local anesthesia. So I prefer local anesthesia. So about 80% local anesthesia, but if they are very sensitive and nervous in the case, I can give IV sedation. Thank you. It is very dependent on the patient conditions. So it's very rely on the thickness of the skin. So if they have a thick skin and thick fat compartment, in the case, I prefer to put 19 gauge in the end fix. But if they have a very thin skin and thin the fat compartment, I put end fix 21 gauge. And sometimes I mix together with, for this patient, I put 3 19 gauge the thread for the jowl lifting together with 1 21 gauge end fix for jowl lifting, total 3 19G and 21G, 121G, and for the nasal fat lifting, I put 1 19G and 121G the end fix thread. So it totally depends on the skin conditions and the patient conditions. So if they have a thicker skin and the thicker the fat compartment, in the case, I put more 19 gauge the end fix thread. But if they have a very thin skin and thin fat compartment, I put more number of 21 gauge end fix thread. Thank you so much. Why not? Okay, I'm going to show the temple again. So this is my temple triangle entry point. So this is a pitangular line. The pitangular line is the 0.5 centimeter below the tragus, okay, here, and 1.5 centimeter above the retro eyebrow here. So we can draw the line, and this is the pitangular line. So facial nerve follow this pitangular line. Then another one is zygomatic arch. This is number 3, this zygomatic arch, and also we can draw the vertical line from the temporal process notch in here. So this is the triangle to put the tragus in the temporal area to lift our facial structures. Thank you so much. Please don't do that. So the question is, do your tragus pattern crisscross post insertion? Will that be a problem? Okay. So especially this end fix thread, I do not recommend to apply the crisscross pattern. So if you just put one end fix thread together with many other types of thread, for example, some another bidirectional thread like 3 to 4. In that case, you can put if you just put the one end fix thread, you can apply crisscross to other threads. But if all your threads are end fix threads, I don't recommend this crisscross type. Reason why it is quite complicated to go through other end fix thread. Reason why they have a very wide the contact surface, and they are very strong in tensile strength. And also, if you apply the crisscross pattern, you can make some irregularity. So all your threads are, if all your threads are end fix, in the case, I don't recommend to apply crisscross the pattern. But if you put just one thread to fix the another threads, you can apply crisscross pattern, the insertion technique. Thank you so much, and it's very important questions. Any other questions? Thank you so much, all you guys, and I hope to see all you guys again in the future. Thank you so much, and have a good day.